Lifestyle diseases. They are diseases that are caused partly by unhealthy behaviors and partly by other factors. Causes a person's habits, behaviors, and practices. Common lifestyle diseases: obesity, cardiovascular diseases, diabetes, stroke, cancer, and depression. Obesity is a disorder involving an excessive amount of body fat that increases the risk of health problems. Cardiovascular diseases are diseases or disorders that result from damage to the heart and blood vessels. Common cardiovascular diseases are high blood pressure, heart attack, arteriosclerosis, etc. Diabetes is a disorder in which cells are unable to obtain glucose from the blood such that high blood glucose levels result. Type 1. Body's inability to produce insulin. Type 2. Body's inability to respond to insulin. Stroke is the loss of brain function due to a disturbance in the blood supply to the brain. This disturbance is due to either lack of blood flow or hemorrhage. Risk factors for stroke include old age, high blood pressure, diabetes, high cholesterol, and tobacco smoking. High blood pressure is the most important modifiable risk factor. Cancer is a disease caused by uncontrolled cell growth. Benign tumors are not cancerous and usually do not spread. Malignant tumors are cancerous and do spread. Causes: certain viruses, radiation, chemicals in tobacco smoke, asbestos, etc. Contributing factors of these lifestyle diseases: bad food habits, physical inactivity, disturbed biological clock. Tips to prevent lifestyle diseases: avoid tobacco use, maintain a healthy weight, maintain daily physical activity, and eat a healthy diet. Prevention is better than cure.
Kerala, a state on the southern part of India, has nearly 600 km of Arabian Sea shoreline. It's known for its palm-lined beaches and backwaters and a network of canals. It is known as God's own country. Population of Kerala comes around 3.6 crores. Lifestyle diseases in Kerala. As per the Health Index report prepared by the World Bank and the Nidhi Aayog in Kerala, more than 52% of total deaths in the productive age group of 30 to 59 years is due to lifestyle diseases. Kerala is known as diabetes capital of India as prevalence of diabetes is high. That is 20%, which is double the national average of 8%. Only 40% of people with diabetes had adequate control of blood sugar. Among those with diagnosed diabetes, 17% received no treatment, 15% were on diet alone, and 68% were on medications. In Kerala, as compared to urban dwellers, rural Kerala have higher rates of diabetes. Cardiovascular disease is the foremost killer of people with diabetes. 80% of diabetic patients die from heart disease. The high rates of premature heart disease in Kerala also results in a high economic burden. 60% of the high income and more than 80% of the low income people are hospitalized for heart attack. In Kerala, virtually every dish including vegetables, fish and even meat and bread are prepared by coconut, meat, milk and oil, and so the heart disease is more in Kerala. The contributing factors are high consumption of alcohol, unhealthy diet, along with very high intake of saturated fat as part of culture, lack of physical activity, sedentary lifestyle, and air pollution. As per cancer registry data, in Kerala, there are 974 female cancer and 913 male cancer patients per million. Actually, in Kerala, overall tobacco is responsible for 50% and diet for 10 to 20% of cancers. Breast cancer is the most common malignancy among the women in Kerala. Kerala population eat more meat than rest of the Indian population. The incidence of colorectal cancer in Kerala is more. Also, it leads to increased risk for large bowel cancer. The incidence of thyroid and ovarian cancers are also more among women in Kerala. Prostate cancer, the most common malignancy among men worldwide, is among the 10 leading cancers in Kerala. Stroke in the young is particularly tragic because of its potential to create a long term burden on the victims, their families, and the community. The proportion of hemorrhagic stroke in young adults is higher than in elderly in Kerala. Compared with stroke in elderly, alcohol use, smoking, and cardiac disease, which are non risk factors, are higher in young stroke. Modernization and urbanization, drastic lifestyle changes, alcohol and tobacco abuse, affinity for white collar jobs, unhealthy eating patterns, and low priority for physical exertion, high levels of stress, and the reason for the rise of non communicable diseases in the state. Unless interventions are made to address non communicable diseases, their burden is likely to increase substantially in future.
Lifestyle diseases in Himachal Pradesh. Himachal Pradesh is a state in the northern part of India situated in the western Himalayas. It is one of the 11 mountain states and it is characterized by an extreme landscape featuring several peaks and extensive river systems. The population of Himachal Pradesh is around 74 lakhs. Even though the population is only 74 lakhs, the population has poor literacy levels, poor personal hygiene, overcrowding in hutments, closely knit social structure, and lack of awareness about common diseases. Himachal Pradesh cuisine is dominated by red meat and wheat bread. Thick and rich gravy with aromated spices is used in abundance as the base of many dishes. So the lifestyle diseases like cardiovascular diseases, stroke, cancer, diabetes are prevalent in Himachal Pradesh. Apart from the common lifestyle diseases, vitamin D deficiency, thyroid problems, anemia and malnutrition were common in Himachal Pradesh. Vitamin D deficiency means too little vitamin D in the body. Most people have no symptoms. In severe cases, deficiency can lead to thin, brittle, or misshapen bones. Vitamin D supplementation is the main treatment. People get vitamin D through food and by exposure to sunlight. For most adults, vitamin D deficiency isn't a concern. Some, especially those with dark skin and adults older than 65, are at higher risk of the condition. Thyroid disease is a condition in which the thyroid gland does not produce enough thyroid hormone. Hypothyroidism, deficiency of thyroid hormones, can disrupt heart rate, body temperature, and all aspects of metabolism. Hypothyroidism is most prevalent in older women. Major symptoms include fatigue, cold sensitivity, constipation, dry skin, and unexplained weight gain. Treatment consists of thyroid hormone replacement. Anemia is a medical condition in which there are no enough red cells in the blood to carry oxygen, which leads to fatigue or shortness of breath. Malnutrition occurs when the body does not get enough nutrients. Causes include poor diet or digestive conditions. Comparison of the lifestyle diseases of Kerala and Himachal Pradesh. Kerala ranked first in Health Development Index, while Himachal Pradesh ranked third. Kerala is more advanced in handling the lifestyle diseases than Himachal Pradesh. Literacy is more in Kerala compared to Himachal Pradesh. Literacy is a main factor in managing the lifestyle diseases. Awareness of the lifestyle diseases and the methods for management of these diseases can help in reducing it. Kerala and Himachal Pradesh are the leading states in India on the basis of 4 indicators. In terms of life expectancy and literacy ratio, Kerala ranked first